at the DEO Fall Summit called Doubling Dental. And I'm here with my good friend for many, many years, somebody who I have loved, respected, admired, I've been inspired by. And he was one of the first guys that came to my studio in Tampa and recorded with me, Dr. AJ Acierno. Thank you, AJ, for coming here.
Glad to be here. Glad to be here. Always good to see you, Amol.
It is so nice to be in Florida this time of the year. It's a little muggy, but I'm excited to be with, this is our family, right? I mean, when we meet so many times a year, and we kind of missed this out in 2020. But this is exciting to be back, and back at the DEO. I know this morning you had a session, and you were on stage. I'm sorry I didn't get a chance to see you, and that's why I wanted you here, because I wanted to talk about what ideas are you bringing to the table in 2021 and going into 2022 that are going to help not only your organization, but overall dentistry to really grow?
Yeah, I think we got to start changing our mind frame. We got to start moving from just surviving to thriving. I hate to rhyme, but I mean, honestly, that's what we're moving. We've always gone by the concept of if you're not growing, you're dying. Okay, so, but we've been in a survival mode for 2 years. So how are you gonna, now we got to move to how are we gonna thrive? And then people come back and then, oh my gosh, Dr. Acierno, the workforce, we can't get people in, we're short staffed, we're this, that. So we really gotta, this is the hardest time ever.
To recruit people.
To recruit, manage, to run a company. Because you still, now you have to focus in on growth.
Right.
But there's so many different aspects that are hurting how you grow. You know, so you got to think differently. You got to think out of the box. It's not like the same old days of, hey, I'm going to grow next year and I'm going to put this revenue cycle in. I'm going to do this. I'm going to do. Well, the first thing you got to figure out is how are you going to manage people? How are you going to manage the teams that you have?
It's so fundamental. Yet sometimes people get stuck in like what the newest technology can I do? And I'm a technology company, right? But you have to really go to the fundamentals, right? And figure out how to really retain, recruit, inspire your own teams. And there is nobody better, and I keep, every year I see these awards won by DecisionOne out of being the best places to work. You recently won that award as well. What are you doing that's special to really inspire your team? Because whenever, you know, your D1 rallies, everywhere else, people are excited to be part of this organization.
I think it's, we want to know what their why is first.
Okay.
It's not about DecisionOne's why.
Correct.
It's about what their why is. And then how does DecisionOne's why fit into their why? How do we help them continue to grow? So we have, you know, small companies within a large company.
Sure.
And we want those companies to thrive. And it's a local business. Dentistry is a local business. So those dentists and those team members are the leaders of that business. So being able to provide an opportunity, sometimes the company overrules the offices, right? And it's like, it becomes this like big, huge, I like local businesses, you know, and I like to put that into context for them. I think that helps.
Right. I mean, I think, you know, you've got to understand your audience is, first audience is the doctors and the teams, right? And you've got to really get them to feel that they're part of something bigger and better, and they're changing people's lives. But it's so hard to do this at scale, right? And you started with one office, you went to 5, 10, 15. Now you're managing hundreds of offices. How do you really operationalize this at scale, where where you are inspiring teams in mass? You are making sure the doctors are aligned with your core values, your mission, and your vision. How do you do this at such a large scale?
Training programs. So you start out with this. You start out with traditions, which is who are you coming to work for, and what are the values, and what are the foundations?
Sure.
But before we tell them that, we want to know, what are your values? What are your foundations? What do you want to achieve?
Sure.
And so we bring in the team members' why, the doctor's why, the team members' why, the organizational why. And how does that all blend together into a vision of the practice? Okay, their vision. Not our vision, their vision of the practice. So you got to start there. Then we teach communication skills, certain communication skills, and you know, communication helps solve two major problems in dentistry, which is in a dental office, you have patients not accepting treatment because of bad communication, and number two, team drama. So those two aspects, right?
Yeah.
And then you move into foundationally what runs a dental practice, and then what's the patient journey, right?
Right.
Patient Prism is a perfect example of that. They know the patient journey and understand that. So
Absolutely.
our customers, the offices, so understanding the offices and understanding their issues, that helps build that culture and helps move the culture through the company.
There is it's a difficult question I will ask you, but I feel comfortable asking you this. There is a perception or a misperception sometimes about DSOs telling doctors what to do.
Yeah.
And I'm seeing incredible amount of misinformation right now on social media about saying, oh my God, DSOs, don't align with them because they're going to tell you exactly what to do. And it's so wrong because I'm in the industry, so I know it. But how do you attack that misperception?
Well, here, first, this industry has been awesome at being able to help each other and help each other grow, right? So you have to be comfortable with your product enough to be able to say, I'm going to come to a meeting like this and share everything possible, because I know that the product's good. That's one. Two, in regards to DSOs telling them what to do, let me just tell you one thing, okay? If you're a private office and you have an associate and the associate's doing something wrong, I promise you somebody in that office is telling somebody what to do, okay?
Right.
At a DSO, we have to make sure that there is quality care.
Absolutely.
No doubt, okay? I think that's something that makes dentists better. As a dentist myself, it makes us better.
Correct.
Okay?
Correct.
Telling them to do something wrong, that is not done in this field.
Correct.
Everybody knows that's the craziest thing in the world, okay? So I'm talking about, and I think what people are talking about is, do I have a say? Can I build this? Can I have a culture within a culture? We actually promote that. I love that, right? I think that's great. Some places are like, no, this is the culture of the company, so this is the culture of theirs. That's not wrong.
Right.
That's just a process, right? People are making it seem like it's wrong. Like you're going in there and going, you can't diagnose that, you got to diagnose this. That is ludicrous. That does not happen. That is a fallacy. It does not happen.
And somehow there is this misperception, like the doctors are losing their autonomy. And I know that's for true because I've interviewed hundreds of doctors in DSOs and nobody says that. But again, their perception exists.
The perception exists because dentists come out of there disgruntled and then they say it. Here, I'll give you an example. Doctor, I want to make $250,000. Okay, cool. Well, this is what you have to do in order to do that. I don't want to work 4 days a week. I want to only work 3 days a week. Or I don't want to work 5 days a week. I only want to work 4 days a week. I don't want to work nights and I don't want to work weekends.
Okay.
But I still want to do $250,000. And we have to say, that's not going to work. It just doesn't work. And your customer isn't just going to come to you whenever.
Right.
So they don't like to hear that. So they walk out and they go, oh, this place is terrible because they told me what to do. We told you that you had to work nights. Like you had to work one night a week, right? Like go. It's your customer. You're in the customer service industry, and you're in the people service industry.
I mean, at the end of the day, what I have noticed at spending time with people like you and leaders in this organization, leaders in this industry, is that the dental support organizations is here to really elevate everybody in the office to perform at their highest level. Give them the support, the clinical support, the mentorship, the marketing support, the back office support, so they can do what they do best, which is clinical dentistry.
That's exactly right. Yes.
And there's no DSO. I mean, there might be one or two out of the 1,000, right? That are not, but one bad or two bad apples are not going to make the whole industry like that.
Yeah.
And I genuinely believe that organizations like yours are really leading the way in promoting the best values out there. You know, you guys came up with your values through the pandemic. Yeah. The S3 was it?
Yeah.
And tell us how S3 has transformed your organization.
So when we're going through the pandemic, you know, the stress of everything that was going on with just the pandemic.
Sure.
Everything. And then we had this social unrest that was occurring throughout America. And we were seeing our team members just go through this strife, like, I mean, it was wearing on them, you know,
Right,
and still is today.
Yeah, absolutely.
Still is today. And the one thing that we committed to was this: I cannot control what is going on
Correct.
in America. I can't control the pandemic.
Right.
I can help control the environment that's occurring in each individual dental practice. How do we help each individual dental practice accept anybody and everybody? Get them to learn that everybody is okay, and when you're here in this place, you're going to be our top priority, and everybody's accepted. That's really how it came to be. It has transformed us to be able to look differently at our practices, right?
Nice.
To really ask them, what do you need? What kind of help do you need? And so many people now are coming to us and saying, I do need help. I am having a tough time, and this is going on in my family. It's transformed us to be able to look at the team member differently than what we did before. And it's awesome. It's an amazing experience.
So the acronym stands for Safe
Smile Space.
Safe Smile Space.
Yeah.
You know?
Safe Smile Space. Yeah.
It's fantastic. You're creating a safe environment for your team members gifting smiles to patients and everybody else. But I've noticed this within the organization, overall Smile Brands organization, where you guys actually listen more now to everybody than ever before. Like, I think the pandemic was that place where you now are more connected with your teams. You're listening more, and you're more in tune to what they want to be, instead of like, okay, here's this big bad DSO, gonna try to tell you exactly what, and it's absolutely the opposite.
So somebody asked me, like, what positive came out of the pandemic? The
Right.
positive that came out of the pandemic, because you get, oh my gosh, we want to grow the company, and that's going to help our team members, that's going to help our doctors. How are we
Right.
going to grow the company? When the world stopped, it was kind of like, okay, can't grow the company, the world stopped. But what we can continue to do is listen to our team members. And when you started listening and forming those relationships, it was like, man, that's where the magic happens. And we never can forget that again.
And that is what's exciting, AJ, about our DSO industry over the next decade, because the pandemic is going to really move us closer to our people, and moving closer to our people is going to mean we're going to be moving closer to our patients and delivering them the care that they deserve.
That's exactly right. Yeah.
And that's why this is exciting to be in this place. So if you are a dental practice today, a single practice, you're a group of small practices, you've got to come to these events like Doubling Dental, the Dicoma event. There's a whole bunch of things to meet people like AJ that are literally changing the industry as we speak. To be part of history is something so amazing, and I feel very fortunate to be part of it.
I think Patient Prism's actually changing a lot of the industry based on what you're doing.
Thank you.
And those type of things. But it's good to be around an industry that is looking to actually be better. Like, it's awesome. There is nobody here that's thinking status quo.
Absolutely
Everything's
not.
good. It's
Absolutely
like,
not.
What is best for patients? Access to care, getting more patients to have treatment acceptance. What kind of technology? I mean, it just goes on and on. It's amazing.
And no, it is truly been a blessing. AJ, you've been a great friend over the years, and I appreciate the support you've given us as an organization, me personally, and I thank you. Thank you for being my friend, and I'm inspired by what you guys have done as an organization, what you guys have done as people to support your soldiers over there in the community, and to do things to support schools from not shutting down. I mean, just the amount of goodness that has come out of your organization,
I appreciate
truly
that.
reflects the vision that you and your brother started, and you've stayed true to that vision, and you keep growing it. And it really, my hair stands up on my head, because I feel so good about being part of this group and ecosystem that wants to be more, do more, and be better every single day. So thank you so much.
Appreciate it. Right back at you. Thanks.
Thank you.
Thanks, Amol.
Thank you.